You're finally free. No more lockdown. So you're about to have sex. Haven't done that in a while. You and your partner get together, and right when you think that it's time for you to spoon and snuggle, you don't even get to that point because someone had an injury. Now you got to go to the emergency room. Do you? Do you not? There are some sexual injuries that you do have to go to the emergency room. And the worst scenario is if you were having the hanky panky with somebody who wasn't your regular partner, if you know what I mean. Don't worry about a thing. I'm going to tell you in this episode the 5 common sexual injuries. Do you have to be seen by a doctor right away? How can you prevent those injuries? And what is causing injury? Outside of the obvious, and having sex.
Welcome to the Dr. Tess 90210 show. Tess Washington, MD, MS, FAAFP, a board certified physician and surgeon with over 20 years of diverse patient care experience, focusing on the optimization of a person's looks, love, wealth, and health. One of the most unique and intriguing podcasts on the internet. Buckle up and get ready to have some fun, but get ready to learn. This is the Dr. Tess 90210 show. And here's your host, Tess Washington, MD.
Hey. It's Dr. Tess 90210, also known as Tess Washington, MD, board certified physician and surgeon. And you have just joined us on episode number 4 of the Dr. Tess 90210 show, where we discuss the optimization of your looks, love, wealth, and health. And you can tell from the intro today, we're going to talk about love, specifically 5 common injuries that you can unfortunately incur while you making love. And do you have to go to the emergency room, which is awkward? It'd be better if you could just kind of like take an aspirin or some chicken soup and then go away. But sometimes you got to go to the ER because you may need surgery. Paraphimosis. Some of our gentlemen are not circumcised, which is fine. It's okay if you're not circumcised, but sometimes that skin can be a little bit tight. And then when you get really excited and when your glans penis is swelling like we want him to do, the skin is creeping back, but sometimes the skin gets a little bit tight when it gets on the further back end. Doesn't go all the way back, doesn't completely retract. And that's called strangulation. You may want to get some medical attention from that because what is happening with the strangulation is you're reducing the blood supply to the penis. This is a medical I'm sorry, it's a medical emergency, and you must be seen in the emergency room. What is one of the ways that we can avoid paraphimosis? Well, circumcision, if the skin is a little bit too tight, if the person who you're having the intercourse with is a little bit too tight, a little lubrication, that may resolve the problem. Accident number 2, Fremulin tear of the penis. Doc, you using some big old fancy words. I thought you said that you were going to keep. Okay, I'm going to break it all the way down. Guys, sometimes you may have this little bitty thin skin, almost like a female hymen, but not. And as that foreskin is sliding back, sometimes that little bitty skin just may rip. It just may tear. The reason why this is a second cause for you to have to go to the ER is because the glans penis is very vascular. And if that skin rips, it could have a very strong blood supply, and you may need to have that bleeding vessel cauterized. That just means that you go to the emergency room and they may either have to burn it to stop it from bleeding or clip it or do something that the urologist is going to do in the emergency room. But you'll know because you'll get a bed full of blood. And unfortunately, If you do incur that injury, commonly it doesn't heal the same way that God made you, and it just may tear again in the same exact place. Talk to your urologist about ways that you could prevent that moving forward outside of just simply lubrication. Common sexual accident number 3, vaginal or anal tear, skin tears. So you're going in there, it's a little bit dry. And you know how you take your mouth and you want to push a spit and push a spit. Don't do that. Don't do that. That's not the right kind of lubricationes, okay? You want to use appropriate lubricant, but sometimes if it's a little bit dry in the valley. Anyone ever drove from California to Vegas? You got that desert in between. You see where I'm going with this. It's a little bit dry. And the friction from you just determined to go through the dry area back and forth, right? Like almost like rug burns, right? Friction, you know what I'm saying? Friction. It could cause a tear, and that could be painful. Here's the good news. You don't have to go to the emergency room for that. All right. But I guess the bad news, you want to hold off on having any form of intercourse in that orifice. You heard me when I said vaginal or anal. So you still could do other things. You know what I'm saying? Just get experimental, watch a few movies. But you want to let that tissue completely heal before you cause some more friction. And make sure you use a little lubricant so that you don't cause that kind of injury. Moving on to our next possible sexual injury, penile fracture. Now I know what you're thinking, Doc. This ain't no real doctor. She gonna say a penis fracture ain't no bone. Listen to what I'm saying. Why do you think they call it a boner? Huh? I like my sister and my son. I gotta give me a that was funny, wasn't it? It's a boner because it's not really a bone. An erection is caused by the blood just woof, just really getting down into the glans penis and making it to the point that it is erect. And the most common way that the penile fracture occurs is when the woman giddy up, giddy up, giddy up, yeah. She riding cowgirl, got a hat on, and I did a TikTok one day. Anyway, yeah. So she riding cowgirl, and she get a little bit too excited. You get too excited. Everybody all of a sudden, click, you'll hear pop, and when you hear that pop, it is a penile fracture. What has occurred is the corpus cavernosum literally broke. Even though it's not a bone, it's a pretty thick hard tissue. This is a medical emergency because the chamber is blood filled. And you just want to go into the emergency room just to make sure that you don't have a vascular injury that needs to be addressed. Just make sure that when your partner goes, she wears a cowboy hat, and in that way, the whole problem will be explained. Injury number 5 is a heart attack. Guys, we just got off of a lockdown. Some of you guys, the suit that you were able to fit before the lockdown, you can't fit that suit anymore. And some of the things that you used to do before the lockdown, you're just gonna get out there and try to go back to your baseline. You may want to take a little bit easy because heart attacks commonly occur during sexual activity. Here's one place that I'm going to put my doctor hat on, my hospitalist hat. Do you know when we are about to risk stratify a patient for a surgical intervention? One of the things that we go through is something called a MET score, MET score, metabolic equivalent score. A MET1 is equivalent to like if you're just like sitting or just standing, just plain, just doing nothing at all. And if you're able to go up a flight of stairs or do a brisk walk on a treadmill at about 3 or 4 RPM, we consider that about a Med 4. Guess what else is a Med 4? Sexual activity, even if you're in the missionary. So basically, I don't know how to say it, but I guess you got to kind of have a good heart in order to give a good heart. Give a good heart. Or Okay, I'm gonna stop with that. I'm gonna stop with that. I'm gonna stick with my day job, but you guys get what I'm saying. So that is really a lot of activity when you're having sex on your heart. And heart attacks do occur. How can I prevent that, smarty pants doctor? Just if you know that you've gained about 100 pounds over the past 2 years, because it has been a while, lockdown, no lockdown, lockdown, no lockdown. Every time you get locked down, you lock down with some Oreo cookies. You may just want to take a little bit easy. Or if you feel your heart palpitations, or just beating real fast. But listen, one thing I want you guys not to do, please, 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 don't mix the Viagra or the Cialis with your blood pressure medication. Okay, talk to your doctor about that. They'll tell you not to, because that's a sure way for us to possibly end up with accident number 5. And I do not have to tell you, that is a medical emergency. You want to be seen in the nearest emergency room, ASAP 911 right away. Some of these accidents could be due to a hormonal imbalance. I had to tie it in with what I do. This is what we talk about: looks, love, wealth, and health. Love and your hormones. Make sure you get your hormones checked, guys, because ladies, vaginal dryness, postmenopausal, like, ooh, it's not, kind of hurts a little bleeding. Yes, ladies, we want to make sure that we get our hormonal levels checked, because the vaginal dryness may be secondary to a decrease in your estrogen. Let me tell you, that little lube that they sell at the store, it really isn't effective. And you want to get something that is bioidentical. We're not going to go into a long lecture on that, but I'm just saying that some sexual accidents or sexual injuries could have a correlation with a hormonal imbalance. Another thing could be hydration. Please make sure you drink at least 3 liters of water per day. Anything that I tell you is not medical advice. Make sure you discuss it with your doctor. But I think your doctor would be like, hey, that Dr. Tess, yeah, that's exactly what I would have said. Let's hydrate, because dehydration can cause some of the sexual accidents that we just discussed. I hope that made you guys feel a whole lot better about having sex, because now you know you can get injured, but as long as you go to the emergency room, you'll be cleared, you'll be able to go home, and life will be better. So that about does it for today's episode of Dr. Test 90210, where we focused on the topic of love. Next week, I'm going to ask you guys to do me a favor. I'm studying for this exam that I have to do in order to maintain my board certification. So what I figure is I can do a twofer. I read this so that I pass my examination, and I discuss it on my podcast, and I make sure that it is relevant, and you guys will walk away at the end of the show with some information that you've gained to make yourself healthier. How's that sound? Yay! I knew that you would like it. Well, thank you so much for stopping by the Dr. Test 90210 show. If you like this kind of content, please make sure you follow the channel and go tell all your friends who don't know about it. Be like, hey, you guys need to come on over. You need to check out this doctor. She's good. She's good. I like her. And I have a surprise for you guys. So I'm actually going to have to come on prior to next Wednesday so that I could announce the surprise. And it's something that you guys are going to totally enjoy. And I put it together just for you, my podcast family. But until then, you have a wonderful few days. Stay safe and have safe sex. And if you do have an injury, please go to the emergency room and get that situation checked out. Gotta go. Have a wonderful evening. Dr. Test 90210 signing off.
You've been listening to the Dr. Tess 90210 show. It's Dr. Tess's passion to focus on the optimization of a person's looks, love, wealth, and health. She practices in the areas of aesthetics, HRT, functional medicine, sexual health, transgender hormone regulation, weight loss, and overall increased longevity while maintaining a happy and healthy lifestyle. We hope you've gotten some useful and practical information from the show. Make sure to like, rate, and review, and we'll be back soon. But in the meantime, hook up with Dr. Tess on Twitter, Instagram, TikTok, and LinkedIn at Dr. Tess 90210. See you next time.